of questions with our participants that we have here on board. Just before we turn to them, my name is Roger Galloway. I am the Communications Director for Mohave County. I wanted to add that the county is implementing immediate changes to its policies because of the evolving nature of the COVID-19. The administration and health department require these new policies to be put into effect immediately. All county offices will now limit face-to-face interaction with the public as much as possible. Members of the general public should conduct business via telephone, email, or regular mail. If it's necessary from the public to drop off documents, they can do so at the drop-off boxes being set up at the county administration building. Also, Development Services will be doing the same. If for some reason it is absolutely necessary to interact face-to-face with the county employees, members of the public should phone ahead to the involved department to set up a meeting time. Individuals who are sick, of course, should not come to county facilities under any circumstances. This applies to all county employees as well. All meetings in county facilities involving over 10 have been canceled for 60 days, they actually started on Friday. The security guards at the administration building in Kingman are meeting visitors at the door, determining the nature of the business and in order that these visitors can be then directed to the proper location. Visitors will not be permitted to loiter in any way within the county buildings. Important to know that Mohave County Public Health is not recommending county facilities be closed at this time. However, due to limited telework capabilities, some departments will have to have employees on location for crucial tasks. Due to unknown factors dealing with the COVID-19 issue, other changes, modifications, and restrictions may have to be put into place. So please be sure to check the latest news at our Mohave County website. That's mohavecounty.us. This important news conference, we're very happy to have with us not only on my left, Denise Burleigh. She is the Mohave County Health Director. Next to her is Brian Attorney, who is the CEO of the Kingman Regional Medical Center. On his left, we have Michael Stenger, who is the CEO of Western Arizona Regional Medical Center. Then to his immediate left, we have Mike Patterson, CEO of the Havasu Regional Medical Center. And finally, on the left of Mike, we have Feliciano Hiron, who is the CEO of Valley View Medical Center in Fort Mojave. So this is kind of unprecedented in many ways, having all of them here as well, and they'll be taking questions. To start off, though, I'd like to see if any of the four of you would like to make just a general statement before we get to questions from the press. Mike Patterson.
Sure. Just wanted to maybe start off by just indicating that we as hospitals have really taken this very seriously. I think you'll hear from all of us as we talk today that we are prepared. We have practiced emergency operations. That's just part of the hospital and healthcare business. And we've implemented in our hospitals, as you'll find out, our emergency operations plans, and have put in measures to prepare for the worst. So that's just something that we inherently do as hospital operators, and I think it's something that we've practiced for many years. So even though it's a very difficult and challenging situation, and it's one that kind of came out of nowhere a few months ago, I would just say in general, although things aren't perfect by any means, we are prepared for this kind of a situation.
Thank you. That was Mike Patterson, who is the CEO of Havasu Regional Medical Center. Michael Stenger, the CEO of the Western Arizona Regional Medical Center. Yes, sir?
So I'd like to reiterate what Mr. Patterson just said. There's no question that preparing for disasters of any kind, community-wide, are something that we are required to do all the time, and we are as prepared as we can be for something that we haven't seen for decades. This is uncharted territory for all of us, and we've spent a lot of time and a lot of effort getting ready, staying prepared, staying vigilant, and basically the general consuming public needs to know that this time of the year, our hospitals are typically at their capacity because we have so many folks here for the winter surge that typically we are very, very busy. Because of what's happened over the last 2 weeks, I got to tell you, our volumes, both inpatient and outpatient, and our ED volumes have dropped significantly. We've canceled elective procedures as requested by the state, the governor of the state of Arizona. We've curtailed unnecessary things for the time being until we know more going forward. So we have capacity in the event that the COVID-19 virus does hit Mojave County. All 4 hospitals have the capacity to ramp up. We've got staff, we've got empty beds, we've got supplies, drugs, all the protective equipment that we would need, and supplies to protect not only the staff but our patients. I will say that I can only speak for War MC at this point in time. We made the decision this morning at our incident command center at 9 o'clock that we were going to close the hospital to all visitors, and clearly nobody under the age of 18 will be permitted. We'll only let visitors on a case-by-case basis for compassionate reasons to be present, and that's for the safety of the general public as well as for our current patients as well as our staff. I know that that's a huge inconvenience and maybe a public relations issue for our general consuming public, but you need to understand we're doing all this in the best interest of keeping people safe.
Thank you. That's Michael Stinger, who is the CEO of the Western Arizona Regional Center. Let's turn right now to Feliciano Huron, the CEO of Valley View Medical Center.
At Valley View, we have gone through quite a bit of our planning and preparation, a lot of reaching out to different organizations in the community, making sure that as one of the facilities that's able to serve our community and privileged to do so, that people will have the confidence in knowing that we, as the 4 hospitals that are represented here, are ready to take care of those patients, work together, and have the understanding that should we need to ramp up during a surge or need additional capacity, that we're able to take those patients on. Again, a lot of questions that have come through quite extensively. We've had guests who've come in the facility looking for testing and so forth. A lot of education back to the community and the public, letting them know that screenings are being done on a individual basis when those individuals meet all the screening criteria. I know that right now a lot of the public is looking to us for testing and screening processes. Those are in effect for those patients who meet the criteria, and we stand assured that we will be taking care of those patients should they need to be put in the hospital.
Thank you very much. That's Feliciano Huron, CEO of the Valley View Medical Center. And last but not least, among our 4 CEOs, we turn to Brian Turney. We're coming to you right here in Kingman, and we're going to him right now, Kingman Regional Medical Center.
Yeah, thank you. I guess the point I'd just like to emphasize is this is a team effort. We have the facilities here. The county obviously has an important role, but our community as a whole, as citizens, really has a key role in tackling this problem. And I guess I would just encourage everybody to learn as much as they can about what they can do individually. Most of this can be handled if people just act appropriately. And I think that's the key, is just people understanding and taking the proper precautions. There's different levels of risk depending on what kind of activities take place. As an institution, we've really tried to do what we can as far as having people have an opportunity to go through a screening process through our what we call KRMC, Care Anywhere. We've made that free to the public, so people can, in essence, get screened by a provider without coming into a doctor's office or urgent care or an emergency department. I just looked at the numbers just through Wednesday through Sunday. We've had almost 300 people avail themselves through that. So that's 300 people that didn't go to a spot where they interacted with other people that potentially could be sick. And so we're trying to do those types of things things. I think all of the hospitals here are a little frustrated that if we had more testing capabilities, that certainly could help the situation. So we're having to eliminate the screen based on certain criteria. And the time to get those tests back is a challenge right now. It's typically 5 to 8 days. It looks like we've got some arrangements through mail that we'll probably be able to get that down to 2 days. Probably everybody's heard this weekend, the Cepheid Corporation got approved for on-site testing. We do have that equipment. We just got notified, though, it's going to be at least 3 weeks before we can get the materials to do the testing. Once that's in place, we'd be able to test people within 40 minutes. But right now, those materials are being shipped to places like New York and Los Angeles, and so the priorities are where there's a bigger outbreak at this point in time. So to me, I think the key is just making sure that the public knows what they should and shouldn't do and are taking proper precautions. And if they behave appropriately, then we shouldn't have the type of things that are going on in New York and other places.
Thank you very much. That's Kingman Regional Medical Center's CEO, Brian Turney. And you'll notice on the dais, we are practicing social distancing right at the very moment. We turn now to our Mojave County Health Director, Denise Burleigh. Denise.
Good afternoon, and thank you for joining us today. As of this moment, there are no lab-confirmed cases of COVID-19 in our county. This is important to note, as there are actually 4 counties that are still at 0. And we are one of those, so that is exciting news for now. We continue to work with our healthcare facilities and partners alongside city and county leadership to ensure a coordinated response and to make sure that we're working together in our communication as we move forward. So at this point, I believe the state of Arizona has 234 cases as a total. A majority of those, of course, are in Maricopa County, with Pima County and Navajo County sort of hot on their heels. So at this point, I would like to open it up to questions, and we can all sort of address, if you'd like, as they seem appropriate to the different groups.
All right. I'll call on the outlets to begin with. You have a question plus a follow-up. After I call on the first group of outlets, then you can start chiming in with additional questions if you like. There's certainly people that I have missed. We'll start off with the Havasu Herald. You can have the first question with the follow-up.
This is Michael Zog. I'm wondering what the total bed capacity in ICUs available within the county are.
At KRMC, we have 20 beds, ICU beds.
At Wormsea in Bullhead City, we have 20 ICU beds and we have 20 PCU beds, which would be reserved for those that are suspected of having COVID-19 or have been confirmed to have had it, but don't have a major medical problem that would require them to be in the ICU.
And at Havasu Regional Medical Center, we have 16 ICU beds and 23 intermediate care beds or step-down beds that we could also utilize.
At Valley View Medical Center, we have 10 ICU beds, and we have an additional 10 intermediate care beds.
Michael, follow up.
Yeah, I guess, can you tell me how many respirators are available at this point?
I don't have the exact number. I didn't bring that with me.
If you're talking about volume ventilators for patients that have COVID with the acute respiratory distress, we have 15 currently available.
Yeah, in Havasu, we have 10 respirators, and but I'm also under the understanding that we could use some of the anesthesia machines in the OR
that's correct.
If we needed
That's
to.
correct.
So there's some additional capacity there if needed.
And at Valley View Medical Center, we have
Governor, as far as social distancing, doing as much business via email, phone, and through other means other than face-to-face. I think in looking at schools, they will remain closed until the outbreak is over. Businesses, I think we're looking at not Some may end up closing, I think, their doors, but again, limiting that face-to-face interaction, looking for ways for people to telework. And we're already beginning to take those steps anyway. I think a lot of businesses have already instigated a lot of that work and exploratory action. So we're looking at many of those steps actually coming to fruition and becoming more of a requirement with that community spread piece.
All right. Do we have a question from Paul Lavoie from Radio Central?
Yes, thank you, Roger, and thanks for the invitation. Paul Lavoie, Radio Central News. This is for Denise. Based on certain demographics of age, number of smokers, number of hospitality workers, how vulnerable would you say Mojave County is on a nationwide level or even on state level?
Well, the evidence would suggest incredibly vulnerable. The social and age vulnerability index that was posted really puts us at one of the highest risks in the country. And I think that's where it's very important that people take this very seriously. And because once we do start to see community spread, as you can see from some of these other counties, they start with one case and they move to 3, and then they move to 10, and they move to 20 very, very quickly and rapidly through in a very short time frame. So we want to have people really thinking about what steps they could be taking today, not when we hear about our first case.
All right. Do you have a follow-up, Paul?
Yes, a family contacted me recently. Their daughter goes to a local high school, and a number of girls on one of the athletic teams were ill. It was about 6 weeks ago, and they feel that they may have already gotten the symptoms. Is it possible that they did and didn't know it at the time, and that they could recatch it?
I don't know about the vulnerability of... I'm not able to answer that question directly. I don't know if any of the hospitals have that.
Well, as far as the recatch it, typically if they've been exposed and that one truly was coronavirus, they probably have immunity built up for those particular individuals. Just the question was, who would they potentially have spread it to? I think we all are, at least at our institution, we're under the assumption there's probably some cases in our county that people are not aware of at this point in time. I think over time, as we have more testing, we're going to have a better feel for that. We've done about over 100 tests at our facility, and there's still 66 that we haven't got results back. So I think to assume that there isn't any just because the numbers are showing 0 right now would be an incorrect assumption.
All right. We have a question from Aga at the Daily Miner. Who has a chance, this is directly for KRMC, who has a chance to get tested at the moment at KRMC? What are the current requirements?
For us right now, because of the limited capabilities as far as swabs and et cetera, and plus just the time it takes to get the results, it's patients that we anticipate potentially could get hospitalized, fever, whether it's subjective or objective. In other words, they said they had a fever or felt like they had a fever, or we actually can measure a fever and a cough. If they have that persistent cough, a fever, and they have other symptoms, we think they're going to be admitted, then we do the test at this point in time. We were prepared to do it on an outpatient basis where people were showing symptoms without the potential of being admitted, but just the lack of supplies at this point in time, we felt like we need to, so to speak, keep our powder dry in case we do have a surge in our area. Potentially, if we can get more materials, we'd like to be able to expand that out into the community. We had a drive-by clinic set up where we could actually staff that, but just elected it would make no sense to start it and then stop it because we didn't have supplies.
There's a general question here. Is everyone communicating with each other and knows what's going on with each of the 4 hospitals and the Mojave County Health Department?
Certainly, I can say from the county's point of view, we coordinated and scheduled meetings with our healthcare providers here starting the first week in February. And we had those on the books, and we have them currently every Tuesday afternoon. And that is so that we can coordinate our actions, so we can communicate any kind of issues and concerns, and so that we can address those questions and how we want to respond back out to the public. But also just to make sure that we're all on the same page, because it's important that we're coordinated and we're working together, and that has to happen for us to have a successful response to this.
Any of the CEOs want to add anything to that?
So it's my understanding that once a day, every day, we're letting the county health department know when we've done testing, and then whether we got the results back, whether they're pending, whether they came back positive or negative. So that's happening every day, at least once a day.
I think the way it's set up is the county is the hub, and then we as the institutions are kind of connecting to that hub. I think that's the agreement, that would be the best way to communicate and coordinate.
All right. Do we have anyone on board from the Rattler? Mojave Daily News? Anyone want to chime in with a question right now?
Hey, this is Brandon from the News Herald. We wanted to ask, do we have any presumptive positive cases?
We do not have any presumptive
And how many people have been
cases at
tested?
this
Do you know
time.
that number?
How many people have been tested, he asked?
So I know that we have 15 tests that have been run through the Arizona State Public Health Laboratory, and we do understand, and Michael alluded to this as well, that we just talked last week about getting test numbers from our partners here. So we do not have those numbers aggregate yet, but we hope to have that here in the near future so that we can tell you the number of tests that have been run in our county.
Yeah, I can tell you at Kingman, we've done 101 tests thus far, as of this morning, 34 negatives, 1 inconclusive, and 66 pending. That's the Kingman area.
We hear a lot about social distancing, especially right now. There's another social that comes to mind. That's social media, and there's a lot of information out there that we know to be rumors, some greatly exaggerated, some not. How would you ask the public to respond to that, Denise?
So I understand social media's role in informing the public. What we're asking for is any information be accurate and medically correct. And that is a place that we need the public's health with. We know there's a lot of information out there. Whether or not you turn on the radio, the TV, social media, it's out there. And you're getting kind of hit from all different directions from these different sources with experts, et cetera. Our goal is to stay with CDC and ADHS guidance because that's where our science is. So we don't vary from that science because that's our base. That's where we get our decisions. This is where we do our work. And so when people have questions, when people have concerns, we ask that you can use our call center. I know KRMC has a call center. Others may as well. But we want to get people to the right sources of information, and social media is not always that source. So
there's no question that the Center for Disease Control and Prevention is one of the foremost authorities on epidemiology. Some of the best scientific minds and physicians work for that organization, and for anybody to question what the recommendations or guidelines are would be foolhardy, because these are professionals who do this for a career and for a profession and are giving us the best advice and counsel that's out there. They are subject matter experts par excellence.
CDC.gov. It's a phenomenally good site to go and get the information that you just talked about, sir. We have a question from Paul Lavoie again. Go ahead, Paul.
Yeah, this question's for Denise. Denise, we've all heard of the chloroquine trials that are going on right now, or the success of chloroquine, rather, with patients in New York. It's probably a two-part question. Can you say if there are any malaria sufferers here in Mojave County that may be using chloroquine, and are we prepared to address the COVID-19 crisis with this drug?
As I understand it, that drug is currently being tested as a response to COVID-19, but I don't have any scientific evidence to prove its effectiveness at this point. And until we do, I think that we're going to stand true to trying to work on prevention and look at mitigating the issues as they come along to us.
Thank you. We have any other questions out there? Someone want to chime in with a question? Go ahead.
Yeah, Denise, a follow-up question?
Sure.
Is that something you would wait for approval from the CDC or a state agency or both?
Well, certainly the CDC would be our ultimate stamp of approval for that. I believe it may also be, thank you,
FDA.
may also be from the FDA.
Yep, I might add that, I mean, that drug's been around a long time. As I've talked with our intensivists, I think that if they had some difficult cases and felt like that there weren't, they felt like that they needed to use that, they would be prepared to use that, even if the science wasn't totally there. I think that, it's going to be physician judgment on that, but it's a readily available drug. It's been used for years and years. So, but as far as from prevention and those types of things, I don't think it really belongs in the arena, just as Denise is indicated, so from a preventative standpoint. So,
Is there anything that any of you would say to our younger individuals out there, the millennials, et cetera, who may or may not be paying as much attention as older people are?
Well, they need to pay attention for sure, because this is serious. And even though they're young and healthy, relatively speaking, they could still contract the virus and still get very, very sick. Obviously, we know that elderly people that are frail, that have multiple medical problems, chronic medical conditions, that have weakened their immune system are most at risk. But now is not the time to congregate in large groups. I mean, schools are closed for a reason. Businesses have closed for a reason. Restaurants are only serving through drive-throughs or through carry-out. So now's not the time to have a party. It's to be vigilant and to stay calm and to use good common sense and be very, very attentive to hygiene. That's how it spreads.
There's also a lot of individuals out there who may have very mild symptoms, but can still spread the disease. And that's something that I feel like we really need to be mindful of. Those healthy individuals out there that might be experiencing the mild symptoms may not recognize that they're actually spreading COVID-19. And so they need to be mindful of some of these recommendations and preventative measures, because that's what's going to keep everybody safe.
All right. We have any other questions from the press? Please ask right now if you do.
Hi, this is
Roger, this is...
Go ahead with the young lady first, please. She started first. Go ahead.
I know that you touched upon this at the onset of the conference, but how well stocked are the county hospitals with necessary PPE supplies, such as the N95 masks, gloves, gowns? And do you anticipate ever running into a problem that, as we see on national media, has plagued places across the country?
well, I mean, I can only speak for us. There's always the potential that it could become a problem. It depends on how hard the healthcare institutions are hit. So, you know, at this point in time, the biggest challenge for us is the N95s. It looks like we're finding some alternative sources for those masks, but that's probably the biggest challenge for us right now as an institution. But it just depends on how hard we're hit as an institution. That's probably, I consider that one of the foundational pieces, is having enough people and having enough equipment. It's something we're going to have to monitor carefully. I don't know what the other situation is.
I would agree completely. It's people and equipment. And right now we do have enough, but we haven't had an insurge of patients at this point. So we're just monitoring the use of our PPE, again, following the CDC guidelines for how to use it and to preserve it. And, you know, we do have enough to handle somewhat of an influx of patients, but it will really depend on if and how hard we get hit.
There's no question there's a concern about supply chain disruption. So many products that are no longer manufactured in the United States come from the Pacific Rim countries, and that's where this all got started. And there's no question we can't count on having supplies come in on the regular basis that they typically do, because there's so much at risk importing things from across the ocean, and then once they get to the United States, you know, the ports being open, the highways being open, the truckers being able to get, you know, supplies distributed to different suppliers. So, and those are things beyond our control. So I think it's fair to say that in the last 2 weeks, particularly this last week, all 4 hospitals have started preaching conservation of very precious commodities of personal protective equipment. Gowns, masks, gloves, face shields, respirators, you name it. Because once they're gone, if that supply chain gets disrupted, we're going to have a problem. But at this point in time, I think everybody understands we're in a pandemic and we need to preach conservation and not misuse our supplies or our drugs, for that matter, because we're just not assured that they're going to be there next week or next month through no fault of our own. And it's not an expense reduction strategy, it's a conservation strategy to just be mindful that there are certain things that we need to protect ourselves, our staff, our patients, and others that we're going to need a lot of going forward.
All right, there was a gentleman that was getting ready to ask a question a moment ago. Do you want to continue with that?
Brandon Messick with today's News Herald. This is for Denise Burleigh. How would you gauge the effectiveness of social distancing measures in Mojave County over the past week?
I have not seen it actively used in many environments, although I do see changes on a day-by-day basis. So I do see organizational changes. I know that cities have made changes in how they structure their business. Sorry about that. My mic was off. I do know that there have been steps taken by organizations every day to limit social interactions at this point. So there is a lot of work being done, but I think we could step that up, and I think we will have to step that up and take it very seriously. I look at California and the governor's message, trying to have Californians take that same message just as seriously. And I think we're going to be in that position as well, so that we can address the COVID-19 issue.
All right. Tara, if you're on there, did you ask a question that we heard, or do you want me to read the one from text?
Well, I don't want to be redundant. I do believe that they answered the question.
I thought so. I just wanted to make sure. Thank you. Any other questions, please?
Yes, John Pinecker from the Mojave Valley Daily News.
Go ahead, John.
This is specifically for Mr. Stanger and Mr. Giron, and I apologize, I came on late, so if you already covered it, if you could give us an idea of how many tests have been taken place, and how many negatives and presumptive negatives or presumptive positives have been completed.
John, I don't have the absolute number, but I can say we've done about 15 tests. 5 have come back negative. The others are pending, and we've had no positives at Wormsea at this point in time.
Okay. Thank you, Mike.
I think we addressed that overall, right? Yes.
And from Valley View, John, I don't have that number right now, but I can tell you that we have not had any confirmations, and we still have one individual who is pending results at this point.
Okay. Thank you, sir.
All right. Any other questions before we move to the conclusion? Gone.
Michael Zog. I'm wondering if there's any update on the inconclusive test from Kingman last week.
Not at this point. When somebody's inconclusive, they do some additional testing on that, and we have not got the results back from that yet.
Do you know when you expect the results?
Typically, it's 3 to 4 days. Unfortunately, with this situation, it's that we have the timing of the results has been languishing. I guess that's probably the best term I can share with you. It's just been painful how long it's taking to get the results back, and it's kind of a result of what's going on nationally.
I spoke with the patient last week, and she said that the county was asking her to remain quiet and not share her experiences. I know you can't speak about any cases in particular, but I guess could you talk about if that is county policy, and if so, why?
No, it is not a county policy. We were asking for patience until we got positive confirmation of the actual result. And that was the actual conversation.
All right. Thank you very much. I'd like to see if each of the 4 COs would like to make a statement here at the conclusion.
I guess just to reiterate what we said earlier, I think this is a team sport, but the county's obviously involved with this, the institution's involved with this, but the key player in this sport really is the community as a whole and how they behave. Ultimately, that will determine how much this spreads, how much the institutions are stretched. I think that people should assume that there are probably some cases in our county. I think that's a safe assumption. And if we're lucky and there aren't any, great, but we need to behave as such, and if we do that, we'll all be better off.
Thank you. Yes, sir.
Stay calm, be vigilant, practice good hygiene, think smart, and be well.
Thank you.
I couldn't have said it any better than the two of them. That's the
Right to
same
the
message.
point. Mhm.
The other big piece I also want to put out there for those individuals who are interested in how many ICU beds are available by county, the Kaiser Medical Health Foundation actually has a wonderful website you can go on, and it actually lists ICU beds by county and those individual counties that also don't have ICU beds available. And for the young folks that are out there, just reiterating the fact that, again, this is a disease process that we all have to be vigilant with. I know it's difficult for a lot of them not to be out socializing, but again, we'd ask that they stay focused, stay healthy, because again, we're going to need that population to really stay diligent and stay close to home during these times.
Thank you, sir. I'd like to get a final statement from our Mojave County Health Director, Denise Burleigh. Denise.
Again, thank you for joining us today. We have actually updated our website, so please feel free to visit that. I think it's much more clean and clear, has a lot of very good, useful information. It's got links to CDC and to ADHS websites, in addition to having a lot of, like I said, very useful information, including printable information for your business or organization. But this particular disease is going to require, as they've said, a community response, and that's going to require action by every single person to ensure that the impact of this is minimal on our community.
I have one final general question here. How many beds are available at the hospitals that are not being used at all?
Well, I mean, there's two issues. One is how many beds do you have and how many staff do you have to be able to take care of those? I mean, our census right now is down about 130 patients in our facility right now. But, you have staff issues. You're talking ICU beds, but also isolation rooms is different than ICU beds, which can impact your capacity. So it gets pretty complicated pretty quickly, and that's part of our planning process that Mike had alluded to, and Mike had alluded to is the two Mikes as far as the preparation, just looking at that and go, what kind of contingency plans can you put in place if those particular rooms get overflowed? So all of that has to be taken into account.
All right.
Yeah, I would just second that. I mean, in a pandemic, we truly have an insurge of patients. There are a lot of other places we can keep a patient, so beds is probably not the biggest issue. It would be the staff and the physicians to be able to take care of those patients. And, so that's probably more of the limiting factor than a bed, so to speak.
All right. I'd just like to say in conclusion, I think we've been very fortunate to have all of you here to relate to our public what's going on, and for the press to have the opportunity to ask some questions as well. Just once again, cdc.gov is a great site to go to get all the latest up-to-date information. It's very detailed. And also our own county website, mohavecounty.us. Thank you very much.
Thank you.